Hey y'all, let's talk about COPD. Now, this is one of those things that as I work with my review students, we kind of get hung up. Not so much of understanding what COPD is, but just all the little factors as far as what stage it falls into, how do you treat, how do you determine it's in this certain stage, etc. So you know me, I've gone over it, I build charts, I'm all about trying to just put it in a no fluff type of layout so that you can easily see it and get it. But I wanted to take a moment just to kind of bag it up and go over the small little details and then hit the charts and things, okay? So hopefully this is helpful, but let's get into it. All right, first off, what is COPD? COPD, stands for chronic obstructive pulmonary disease, and that consists of chronic emphysema and chronic bronchitis. Oftentimes, we eliminate that and just put COPD in a category all by itself. But it's like it encompasses all of that, okay? So it's a chronic obstructive pulmonary disease. Chronic emphysema, chronic bronchitis are chronic obstructive pulmonary diseases, okay? Now, there are 4 stages of COPD, okay? We have a mild stage, we have a moderate stage, we have a severe stage, and we have a very severe stage. Now, COPD is commonly secondary to smoking, right? We'll talk and get into that. You need to tell your patients to quit smoking, etc. But that's one of the common factors. I say this before we get into the, my common breakdown because I want you to think of it in this fashion. Now, I tell you when we're preparing for boards, think of things in categories of assessment, diagnosis, evaluation, and treatment. This is how they're going to test you. This is what they're trying to make sure that you're able to do to process and facilitate on all patients with any kind of condition, basically, because you need to be able to assess them. You need to come up with a diagnosis, know what kind of diagnostic exams to do, how to evaluate these, and how to treat. We know this, but we don't think of that when we're working through it. So I want you to, while you're studying, go ahead and break it down in that fashion. So when you see the scenarios on boards, your mind automatically starts to answer those questions, right? And when you do that, it helps you to really see what they're truly asking you in that stem of the question. But anyway, so let's go through that, okay? So when you think of that, how do you assess? And this is how I want you to study. Ask yourself those questions. How do I assess somebody who may have COPD? So your patient may come in to you and they may start complaining, of more shortness of breath. And honestly, in the mild stage, this is typically why COPD is not identified until later, because again, it's typically secondary from smokers. And they're typically asymptomatic in the mild stage. The only thing they may have, exhibit are things that they believe to be secondary from smoking for so many years, like a smoker's cough or some shortness of breath, but it's so mild that they brush it off typically. But things that they may have is a cough, a chronic cough. They may express being short of breath. They may express dyspnea on exertion. They may tell you they have a history of smoking or significant other smokes and have smoked for years. They grew up in a household of smokers, so they get, secondhand smoke. Have they worked somewhere that there may be like lung irritants or things that they have been around for a number of years? These are all the things you want to know, think of, assess when you're first going through all of that, okay? So you're asking those questions. Family history of COPD. Do you smoke? Have you ever smoked? That's when we go through those pack years. Do you have shortness of breath? Do you get short of breath when you're walking to your mailbox or going to the walking from your car to the grocery store or whatever? You're asking these things. So when you think of assessment, those are just baseline things that we're assessing. Now, diagnosis. So assessment, diagnosis, right? So diagnosis. So for this, I like to tell y'all, so you're thinking of differential diagnosis, so they can be asking that to kind of see if you're able to figure those things out, or diagnostic exams, right? So differential diagnosis, we're starting to think, hey, this might be COPD based off of some of those assessment findings. Diagnostic exam, there's different lung function tests, but spirometry is one of the most common for COPD diagnosis. So we want to do spirometry because that breaks down your FVC, your FEV1, and the ratio of the two, right? Now, if you think back of your chart, that's what we're looking at. We're looking at that FEV1 to figure out the categories they're in, right? That's the easiest way that I tell you guys to categorize them. And we'll get in that in a second. But okay, and I want you to understand that FVC, so that's the forced vital capacity, right? So what does that mean, Brittany? That means when you tell them to blow out all of that air, I want you to expel all the air that you can. We're trying to see how much comes out. It measures that basically, how much they expel. Now, the FEV1, basically the same thing, but you want them to blow out as much air as they can in 1 second after they take a deep breath. So after they take a deep breath, now blow, and then 1 second. And sorry y'all, but so you want them to take a deep breath, and then after that, blow as forcefully as possible, all the air they can get out in 1 second, and you measure that, and then the ratio is the percentage of that of the two, basically, right? So what does that all mean, Brittany? Okay, so now that we get those numbers, that's what's helping us into the chart, right? So we did our assessment, right? So do they have family history of COPD? Do they smoke? Have they ever smoked? Are they short of breath? Do they have dyspnea on exertion? Do they have a chronic cough? The diagnostic exams, we're going to do a spirometry. What is that FEV1, right? Then evaluation. So evaluation, this is more long-term in a scenario. So, hey, if the person is diagnosed with COPD, how are you evaluating this patient? You're bringing them back frequently to make sure it's not worsening, they're not progressing in those stages, because you know what, COPD is not a cure, but we do have different medications to treat and try to maintain to prevent such a rapid progression in it, okay? And then the treatment. Now, the treatment is based on which stage they're in of the 4 stages, right? And so let's just talk about the chart, okay? So y'all know, if you have my book, that I break it down in the chart, and if you ever done any of my reviews, I tell you guys to think of things in ranges. And when I say, range, there's 4 stages. So what's at the lowest, what's at the highest? And then everything else will fall in between, right? So it's an easier way to retain that. So with this, we have our mild stage, we have our moderate stage, we have our severe stage, and a very severe stage. Now, in the mild stage, you're looking at the FEV1. Now, as far as symptoms, again, mild, they're asymptomatic, right? Typically asymptomatic. The FEV1 is around 80% or greater, right? Now, on the opposite end, the very severe stage, they're having constant, shortness of breath. They have this horrible chronic cough, but their FEV1 is less than 30%. So range, right? That's our scale. Greater than 80 at the mildest stage, less than 30 at the very severe stage. So the other two fall in between, and it just gets worse. Basically, as it progresses, it's going to get worse. So, okay, they were asymptomatic. The FEV1 is 80% or greater. Moderate, it's a little bit worse, right? So the FEV1 is anywhere from less than 80 to 50. So it's in that range, and the symptoms, they start to have periodic shortness of breath. All right. Next, stage 3. That's the severe stage. It's even worse than that. The FEV1 is anywhere between 30% and 50%. It's getting worse, right? And their symptoms are more frequent of the shortness of breath, the dyspnea on exertion, the cough. And then the 4th stage, the very, very severe stage, the FEV1, like I told you already, is less than 30%, and they have constant symptoms. So that's easy to identify. So when you categorize and think of it that way, and let me know if y'all want a copy of that. You know what? I'll do a link later on, and y'all can go about getting it from that. But we'll talk about that later. But just to break it down, or write it down, take a moment and write it down what I'm saying to you in that chart format. Mild, the FEV1, you can add the symptoms if you want to, and then treatment, okay? Moderate, do the same. Severe, do the same. Very severe, do the same, right? In those categories. Now, as you know which category it's in, which stage it's in, Now we treat. The symptoms get worse, the treatment increases to treat the severity, right? So in the mild stage, again, FEV1, 80% or greater, symptoms, they're typically asymptomatic. So we want to treat them with a SABA or a SAMA, meaning you can treat them with a short-acting beta agonist or the SAMA, which is an anticholinergic, is short-acting for that as well, but these are your rescue inhalers. You have that across the board PRN, okay? And the only thing else you're going to do in that mild phase is if it's flu season, if it's anywhere from October to March, you are going to give them a flu vaccine. Testing purposes. If they tell you, hey, it's in October, hey, it's in whatever, October through March, give the people the flu vaccine because that's what they're trying to see, okay? Next, stage 2, the moderate phase. All right, their symptoms are starting to increase. They periodically may have some shortness of breath, etc. FEV1 is less than 80% to anywhere to 50%, okay? So then we already have our SABA or our SAMA PRN on board. We keep that. And now we're going to add in a LABA or LAMA. And when I'm saying one or the other, for testing purposes, if you started with a SABA, a short-acting beta agonist, when you get to the next stage and add on a LABA, a long-acting, okay? If you started out with a SAMA, a short-acting muscarinic agent, which is your anticholinergic, then when you bump up, you're going to do a LAMA, a long-acting muscarinic agent. Make sense? But that's just for testing purpose. So that's why I say either or, because with COPD, we do either or. Now, first-line therapy are those muscarinic agents, your anticholinergics. But on testing purpose, you may see either or, because you can treat with either or. Practice, we kind of do it a little different because you can combine. But again, for testing purposes, we're going to start with that SABA or SAMA, and then we're bumping up to a LABA or LAMA. And then again, if it is anywhere from October to March in flu season, you want to give them that flu vaccine. And then you also want to start pulmonary rehab. Okay? Now, third stage, we have our severe stage. FEV1 is anywhere from 50 to 30. The symptoms are more frequent now. We have our SABA or our SAMA, our LABA or our LAMA. If it's flu season, we are giving them that flu vaccine. We have the pulmonary rehab on board, but now you want to add in an inhaled corticosteroid. And then lastly, we're in our very severe stage. The symptoms are constant. The FEV1 is less than 30%, so really low. And we have our SABA or SAMA on board. We have our LABA or LAMA on board. We have that flu vaccine if it's anywhere from October to March. We have our pulmonary rehab on board. We have our inhaled corticosteroid. And now they need oxygen therapy 24/7. And in very, very, very critical states, they may possibly need surgery. This is a life-threatening stage. Again, there's no cure. But my whole thing is, see, when you break it down, you understand the why, you go through, you understand the assessment level of it, the diagnostic level, the evaluation level, and the treatment. The chart is easy peasy, right? So the chart is just a simple layout that's telling you which category it falls in. These are the gold standard stages of COPD. You see which one it falls into and you treat accordingly, okay? Now, again, I'll put a link on here for you guys to kind of help if you want to get that, how I have it broken down. But I advise you to slow this video down and write down what I said if you are struggling with COPD. Hang it around your house as a huge like flash sheet, and you just recite that every time you see it, okay? All right, happy studying, you guys. Share with a friend if you found this helpful. Share with a colleague. Save it for later if you need it. And meet me back here for more topics and tips. Bye, y'all.